Hello, my friend Sabuda. Welcome to medical science class. As a student of medical science, I want to take the medical science of theoretic Ya alif lam mim. Ya Allah Shafi Allah Mafi Allah Shafi. Ana Abdul Muhammad Shafi. Ana Abdul Muhammad Shafi. Now, my friend Sabuda, I am servant of Allah. My name is Muhammad Sheikh. With last clone of Dr. Muhammad Sheikh. Sir, clone like clone cells, cellular component, DNA, program, as far as I know, Allah knows what. Now, my friend Sabuda, what is medical science? Medical science is the branch of science described elaborated about creation, unification like Homo sapiens. Scientific name of the we described elaborated about disease, some common disease. Last lecture we described about the allergy particle. Now we described elaborated about heart disease. Now discuss about common disease like gastroenteritis, infection in GI tract. What is the reason? Infection of GI tract, there is a current. What is the reason? First, peptic ulcer disease. What is peptic ulcer disease? Peptic ulcer disease is a disease. There is a ulcer formation or erosion formation, or there is a harm in the stomach cell or duodenum, harm or heart, and injury occurs. Either reversible injury or irreversible. If reversible injury can correct. How correct? How peptic ulcer disease occur? Peptic ulcer disease commonly occur by HCl secretion is if you take not enough food or proper time food, balanced time food, whatever. When you have hungry, not take food, but HCl secretion from skin, hydrochloric acid. That HCl hot chain, there is a not liquid food into the direct contact to stomach cell. Then stomach cell injury and ulcer. That is peptic ulcer is common cause on general. But there is a bacteria like Helicobacter pylori. If that bacteria enter into your stomach, then that policy also peptic ulcer disease occurs. In case of Helicobacter pylori, the treatment is pylori, or in case of there is a drug combination, metronidazole, amoxicillin, metronidazole, omeprazole. Three drug combination is Bangladesh common name, Bangladesh drug trade name, pylori combination. Adult dose 80. That is the Helicobacter pylori induced peptic ulcer disease. But ulcer in HCl induced peptic ulcer disease, what is the treatment? Take adequate food, what time. If you feel burning sensation in your GI tract or in your esophagus, burning sensation, pain in stomach area, after take food, and after take food is pain, there is a pain feeling stomach, you know that there is a disturbance of stomach. There is a chance of peptic ulcer. And there is a burning sensation in GI tract, like esophagus area. That is the symptom of peptic ulcer. In that peptic ulcer disease, what HCl induced, take adequate food in proper time. If HCl come, HCl secretion come. What is the HCl secretion reduce? What that HCl secretion reduce? Proton pump inhibitor in case of omeprazole. And the first generation, next generation esomeprazole, next generation dexlansoprazole. But if you first go to the dexlansoprazole, then omeprazole, esomeprazole not work. Cure is more early time, but you next time you take to dexlansoprazole more dose. 2 times to 3 times, 4 times largest time. That is the reason proton pump inhibitor. But before proton pump inhibitor, if you suffer that 1 week, you take just magnesium salt, magnesium hydrochloride or magnesium salt. In case of Bangladesh, say omeprazole, proton pump inhibitor. Just before omeprazole, that is 1 month you suffer that disease. But 1 week you suffer that disease, it's HCl induced peptic ulcer disease. You take the magnesium salt, alkali, weak alkali. Magnesium salt what is weak alkali. Weak alkali what happen? HCl reduce, there is a burning sensation in the stomach area. Acid alkali reaction produce salt and water. Magnesium hydrochloride. Magnesium sulfate or hydrochloride, you see that. In Bangladesh, trade name Antacid Plus Store Company. Take that, just check that and correct that. Internationally, say the magnesium hydrochloride, magnesium oxide, you see that. Emulsification, see the trade name. Understand? I think we can understand. Now medical science is vast, not numerous. But then magnesium, when you take correct, then you take the food at HCl induced peptic ulcer disease. Then you, what happens? Then you adequate food, take proper time food, and when burning sensation or pain come, take the liquid and or food, then that reduce the pain. By that you use gradually. When 1 week take the medication. After 1 week you feel better, continue medication or 3 days, then stop the medication. That is the policy. But if NSAID induced peptic ulcer disease, in case of Europe, they take painkiller, any pain, they take NSAID. NSAID induced painkiller treatment is stop NSAID taking. If you feel pain, take to NSAID with proton pump inhibitor. Otherwise, peptic ulcer disease. Then, in case of NSAID induced peptic ulcer disease, the treatment is same: omeprazole, proton pump inhibitor. If omeprazole is not work in omeprazole is not work in 2 weeks. After take omeprazole, diagnosis is correct, is not work, then esomeprazole. Esomeprazole is not 2 weeks work, diagnosis is correct, then dexlansoprazole. Try to understand that. But that is third diagnosis. But dexlansoprazole, then not work, then dexlansoprazole diagnosis is correct, 3 weeks, then 4 weeks. That is gradually reducing. Understand? I think we understand. Thank you very much, my friend. Supporter. Today is enough. We elaborated about gastroenteritis. In case of gastroenteritis, the GI tract, the stomach, that is common. That is the reason I elaborated that peptic ulcer disease. Thank you very much. As far I know, Allah the best, never the best. And if I do mistake, you see the book, Sir Stanley Davidson. I did that.